Welcome to the seminar on International Students and Mental Health, presented by Dr. Aziz Nashif. We are first going to speak about some important information about the topic of mental health. Just like physical health, everyone has mental health to care for. Your mental health is the foundation for your emotional well-being and ability to function in your environment. Mental health refers to your level of psychological well-being. It is the ability to enjoy life and deal with the challenges you face every day, whether that involves making choices and decisions, adapting to and coping with difficult situations, or talking about your needs and desires. A person feels mentally healthy when they feel like everything is working well. You feel good about yourself, your relationships with other people, and are able to meet the demands and challenges of everyday life. Why is mental health so important to speak about? Well, we know that students with positive mental health realize their own abilities, cope with the normal stresses of life and work, and also study more productively. At the same time, we may take our mental health for granted and may not notice the components of our mental well-being until we experience problems and stresses in our life. Mental health difficulties refer to changes in the person's ability to cope with and function in daily life. These changes can occur at any age and at any time in a person's life. However, one thing we know from research conducted on international students is that due to some of the unique challenges they face, such as cultural shock, international students are at an increased risk of experiencing emotional difficulties compared with domestic students. Fortunately, services on campus are available to support you. We have professionals which includes counselors, medical doctors, psychologists, psychiatrists, and nurses. In counseling services and health services, campus wellness provides access to all of these types of professionals. These professionals are here to help. The concept of mental health is viewed differently around the world. We will now turn to speaking about cultural differences and perceptions of mental health. There may be times in life when we feel out of balance and have difficulty managing the stress we face. We may think about coming into counseling services or health services to speak with a professional about our concerns, or may have been recommended by a friend, academic advisor, professor, or someone else who may be concerned about our mental well-being. At the same time, speaking with a mental health professional is not an easy thing to do. Many people don't ask for help because they feel ashamed or scared they will be labeled as crazy, weak, lazy, or inadequate. Some people are afraid friends or family might judge them and treat them negatively because they sought the help of a mental health professional. The reality is, we all need a little help sometimes, and that is okay. That doesn't mean anything negative about us. It simply means that we are human. We know that humans have emotions, concerns, thoughts, needs, and stresses. Mental health professionals can help you balance these important pieces of yourself so that you can maximize your ability to excel academically. No issue is too small or too insignificant to seek assistance for. In fact, 1 in 5 Canadians will seek out help for their mental health during their lifetime. Over 1,900 UW students sought help from counseling services in the fall term of 2016. Remember, you are not alone. The concept of mental health is applicable to everyone, not just to individuals with mental illness. We have mental health just as we all have physical health. No one falls into a simple binary system of mental health versus mental illness. Instead, mental health stretches across a continuum, and this slide demonstrates this continuum's 4 stages of mental health. In the first stage, healthy, a student is able to function as they normally would. The student feels comfortable, confident, and capable of performing at their best. A student in this stage is taking care of their mental health by maintaining a healthy lifestyle of nutrition, physical activity, adequate sleep, and spending time with their sources of social support. In the second stage, called reacting, a student has encountered mild, often predictable, and usually temporary stress. Difficulties with your supervisor or conflict with a family member back in your home country might serve as the source of this type of stress. Students in this stage may feel physically ill or nervous, have difficulty sleeping, become forgetful, begin procrastinating, and/or reduce social activities. They might seek an extension for some assignments, but will not likely require further academic accommodations. When in this stage, it's important to get adequate rest, sleep, and physical activity to be able to cope as effectively as possible with the source of your difficulty. Sometimes in the reacting stage, the stress is prolonged or becomes more intense. When this occurs, a student will be in what we call the injured stage. Their functioning is more significantly disrupted. They may feel angry or depressed, have trouble sleeping, become more socially isolated, and/or experience a significant decline in academic performance. In such a case, counseling services or health services may facilitate a referral to accessibility services to speak with someone about possible academic accommodations or offer you guidance on reducing academic demands. The final stage, the ill stage, is experiencing severe functional impairment as a result of a diagnosable mental illness. For example, depression, generalized anxiety, or post-traumatic stress disorder. In this case, in the final stage, a student may have difficulty controlling their emotions, feel overwhelmingly depressed, experience constant fatigue, and/or exhibit thoughts of suicide. During this stage, accessing appropriate health or mental health care is often needed, although it can be especially difficult to reach out because of how challenging life becomes in this stage. We will now turn to speak about the concept of culture shock and also provide strategies for managing it. Culture shock includes the anxiety produced when you move to a completely new environment. You may have thoughts or feelings about not knowing what to do or how to do things because the situation you're in is brand new. You are in an unfamiliar environment. What you might also experience as a result of culture shock is a lack of familiarity of one's normal customs. This can include lack of familiarity with the Canadian educational system. Students also experiencing culture shock may experience physical and emotional discomfort. It's important to realize that culture shock often sets in after the first few days or weeks of entering a new country. But it's also important to note that some students will not experience culture shock at all. It is quite a common experience that many people are not fully prepared for the impact a new culture may have on them. They may experience a number of different symptoms, including extreme homesickness, a desire to avoid social settings, feeling hostility towards the host culture, depression and feelings of helplessness, difficulty with coursework and concentration, increased anxiety related to new food, weather, and cultural expectations, difficulties sleeping, and differences in personality. It is important to remember that this is a very normal process that nearly everyone goes through. So if you find yourself experiencing one or more of these symptoms of culture shock, the next question becomes, what can you do about it? It's important to realize and understand that culture shock is a normal and understandable reaction to adjusting to life in a new location. It's important to first recognize what you are feeling. From the symptoms presented in the previous slide, we may be able to better understand how we are feeling. It's also important to understand that you are not a failure. Some things that you might try to do are to try to get involved in your host culture. You may also try to familiarize yourself with your host culture. For example, some students will research the country that they're in to learn more about what they can typically expect. Also, keeping busy or speaking with somebody else are two other ways that you can manage the symptoms of culture shock. We will now turn to the concept of self-care by first defining what it is and then providing ideas for how to practice it. Practicing self-care can help manage symptoms of culture shock as well as the daily stresses of academic life. You may have heard the term self-care before, but you might be unsure of what it means. Self-care activities are things you can do to help yourself achieve a better life balance, a better balance between your life in school and out of school. Achieving this balance can help you when times get stressful because your system is in a more optimal state before the high-stress time starts. Said another way, by practicing self-care, we can buffer ourselves from experiencing higher levels of stress. The first self-care tip is to eat regularly. Eating regularly helps fuel your body and brain to help you get through your day-to-day commitments and gives you focus. Try your best to get 3 nutritious meals a day and pack yourself healthy snacks when you're away from home. Another tip is to try to give your body a break from sitting while you are studying. Exercise or physical activity has been linked to stress reduction in many studies, as well as to decreases in symptoms of anxiety and depression. Try to stay connected with the activities you enjoyed before coming to university, or take the opportunity to maybe try something new. The athletics department offers many different opportunities on campus for you to become active. Another tip in terms of self-care is getting adequate sleep. Give your mind and body a time to rest each day. Studies have shown a correlation between getting good sleep and grades. Getting a regular 7 to 9 hours of sleep per day is an essential part of self-care. For more information about sleep health and tips for sleeping well, to access our Sleeping Well seminar. Some students find meditation and guided relaxation exercises to be helpful as another way to practice self-care. Meditation and guided relaxation exercises are quick activities you can do to promote stress reduction and fit self-care into your daily routine. Recent studies have shown that just 10 minutes of meditation a day can lower anxiety. Not sure where to start? For guided meditations and relaxation exercises, please see our online workshops and seminars. We will now turn to speak about the concept of resiliency as well as ways of cultivating it in your daily life. What is resiliency? According to the American Psychological Association, resilience can be defined as the process of adapting well in the face of adversity, trauma, tragedy, threats, or significant sources of stress. It means bouncing back from difficult experiences. Building your resiliency skills can help you face life's up and downs more evenly, enabling you to be able to handle change and adversity when they come along. It's also important to recognize that everyone can learn skills and strategies to be more resilient. Resiliency is not something that is fixed. One tip for cultivating resiliency is to remember your strengths and accomplishments when you are feeling down. You can pick big things like getting accepted into UW or a sports victory, for example, or small things like holding the door open for someone. Think about a time that you went out of your way to help someone. You could also use coping thoughts to remind yourself that an upsetting situation you're in is temporary. For example, if you are struggling to get along with your roommate, remind yourself that you'll be moving out in 4 months. If you find you don't enjoy the subject matter of a particular course, remind yourself that the class is only 12 weeks long, and then you'll have a new set of courses you might enjoy more. Another tip for cultivating resiliency is to take time to engage in activities that promote self-care. This could mean setting up a weekly call with a friend, family member, or mentor back home and keeping them up to date on your accomplishments, both big and small. By doing this, these individuals can help remind you of good times you've had and strategies that have worked for you in the past. Also, finding an activity you enjoy that engages your brain creatively, that gives you a break from studying, can also be effective. Things like doing a puzzle, drawing, planting a garden, learning to knit, playing a musical instrument, or singing are activities that can provide space between the stresses of school and your daily life. Yet another tip for cultivating resiliency is the concept of positive self-talk. Take a good look at your thoughts and what you tell yourself day to day without even realizing it. Sometimes we suffer from patterns of thinking called cognitive distortions. For example, you might often turn to something called overgeneralization, where you see a single negative event as a never-ending pattern of defeat. So, for example, imagine you ask someone out on a date and they decline. If you were overgeneralizing, you might think to yourself, I'm never going to get a date. No one will ever want me. When in reality, this current rejection only applies to one possible date in a whole lifetime of dating possibilities. To practice positive self-talk, in this example, you might instead tell yourself, you know what, this time it didn't work out, but that doesn't mean I won't go out with someone else. I have lots of great qualities and I just need to find the right person. It's very easy to feel overwhelmed with all the responsibilities you have as a university student. This next tip helps yourself during difficult times by setting goals and problem-solving difficulties that you have. Going through this 6-step plan can help yourself lower your stress levels during your academic career. The first thing is identifying the problem you are facing and stating the problem as clearly and objectively as you can. The second step would be taking a moment to understand your problem, asking yourself questions like, have I ever faced this before? And if I did, what did I do then to help myself? What would be different if the problem were solved? After that step, you could brainstorm possible solutions. You could try to generate at least 5 solutions without any judgment about what would work best, just getting those 5 solutions down on the page before proceeding to the next step. The next step would be looking at those solutions and comparing your options by listing the pros and cons of each and eliminating the least desirable or actionable option. The next step would be to choose one of those options as a solution. Rank your possible plans in order of preference and make a plan to carry out what you've chosen. Take action on the plans you've made. Try to set effective and achievable goals for how to do what you intend to do and do them. We will now shift focus again and speak about resources that are available for you to use. Stress and anxiety are the main reasons why someone might see a mental health professional on campus. Going in for counseling on campus is completely confidential, within the bounds of the law. It is important to understand that if you go in for counseling, there will be no negative implications for your academic future. There will be no information on your transcript pertaining to you coming in for counseling. Thank you very much for viewing this seminar. Please contact counseling services for further information. If you feel like your situation is urgent, please contact our office or any of the helpline resources, such as Good to Talk or Here 24/7, listed above. Thank you very much, and best of luck in your studies at UW.